All right, so as adults, we have 206 bones. However, when we were infants, we had a lot more bones because our bones had not fused all together yet and also had not been converted from spongy bone to hard bone. All right, so we have, regardless though, we have two major divisions. We have our axial skeleton and our appendicular skeleton. So just to give you an imagination of what we would look like without bones, here you go. We would be blobs on the floor even if we did have our muscles. So the two divisions that we have the first one is the axial skeleton and we have the appendicular skeleton. So axial skeleton means it's going to be on the long axis of our body. And furthermore, it's divided into three regions. We have the skull, we have the vertebral column, and we have the bony thorax. And then the appendicular skeleton is broken into three regions as well. We have the pectoral girdle, and so right around our shoulders and what's attached to our ribs. We have the pelvic girdle, which is our pelvis, and then our appendages, which we can't see here, so I'm going to draw our arms and our legs. All right, so infants have a fontanelle, and I'm sure you guys have heard of a soft spot on a baby's head. And so this is because these fontanelles are going to be thickened fibrous membranes that are going to just not yet be ossified. And this is important because this helps for that infant or that fetus being born and travel through that birth canal. And if a infant arrives via vaginal birth, then it usually has a cone-shaped head, and usually the larger the cone shape to it, that means that the fetus was longer in that birth canal during labor. And if it's more rounded, then which we see a lot with C-section babies, they tend to have round shapes because they did not travel through that birth canal. And so over time, I mean, after a couple of days, it does go back to normal. And also what this allows for is the rapid brain development because during the first couple months of life, brain growth is very rapid. And so to accommodate for that, if all those bones were fused together, then there would be an issue where that brain would not be able to grow nearly as much. Our frontal bone is one of our cranial bones, and this is going to be unpaired, meaning that there is one. It helps to form the forehead as well as the roof of the orbits for the eyes. So for the structures that we are responsible for knowing will be these four. So let's start with the supraorbital margin. So here it is, supraorbital margin. And this, here now I've highlighted both sides, is going to be the superior ridge of the orbit or for the eyes. And so in terms of the bone itself, this is going to be the most inferior portion of the frontal bone. Next, what we have is the superciliary arch. And so let me circle that right above here. And this we find above our supraorbital margin. And this is commonly known as our eyebrow ridges. The middle of the frontal bone is right here. And this is going to be the glabella. Okay. And then lastly, the supraorbital foramen, which the foramen meant a hole, is going to be the midpoint of the supraorbital margin. So what we find here are two holes, and this is for blood vessels to penetrate through, as well as for nerves. Our parietal bones are also considered to be cranial bones, and so now there are two of them. And this now, here if we highlight, this is a parietal bone and parietal bone. There is going to be a left and a right parietal bone. This now helps to make the lateral walls of the cranium, so towards the sides here, as well as the roof of what we find. And so it will here now articulate with our frontal bone in front, as well as with our sphenoid bone, the temporal bone, and the occipital bone. All right, so a prominent zygomatic process curves both laterally and anteriorly to unite with the temporal process of the zygomatic bone. And that will be right here. And so this will unite with the process of the zygomatic bone, and together now what this makes is the zygomatic arch, which is that cheekbone arch that we see on us. On the temporal bone, the mastoid process, which I'll circle here, is going to be this prominent bulge that's on the inferior surface of the temporal bone. And this is large because it's an anchoring site for muscles that help to move the neck, which are slightly larger. Next, the styloid process, which I'll circle here in this blue. This is going to be a thin, pointed projection of the bone, and this serves as an anchor site for smaller muscles of the hyoid and of the tongue. And then the carotid canal, which here I'm circling in black, this is going to be medial now to the styloid process, which here in this picture is in blue, okay? And this is important because it helps to transmit the internal carotid artery going to the brain. Each temporal bone will articulate with the mandible inferior to the base of both the zygomatic process in the depression called the mandibular fossa. And so the mandibular fossa is what I am highlighting right here. So together, when we have the mandible that will articulate then with the temporal bone, here this creates the joint of the temporal mandibular joint, or commonly you probably have heard of the TMJ joint. And so that is when some people have like issues with their jaw, usually it's that joint that is affected at the temporal mandibular joint. On the external portion, what we find is the external auditory canal, and this is for hearing. And this will be near the squamous region, which is going to be the flat region, and also an extension from that zygomatic process. Now on the inside portion, so facing our brain, will be the internal auditory canal. So same hole, just on the inside of that temporal bone versus the outside, which is going to be the external auditory canal. The occipital bone is a single bone that forms the posterior portion of our skull. Now let's go through some of the structures. First, the magnum foramen. That is going to be this huge hole that we see. And the magnum foramen is going to be the division between the brain and the spinal cord. So this hole then is for where the spinal cord comes out, and superior to that then would be the brain. Lateral to the foramen magnum, we have the occipital condyle. So here I'm circling them in this dark navy. And so these are going to be where the base of the skull is going to articulate with the first cervical vertebrae. So when we shake our heads, yes, we are rubbing our vertebrae with these occipital condyles. Again, these are now lateral to that huge hole of the foramen magnum. Next are external occipital protuberance. This is what you can actually palpate and feel. So it's a big bump that you feel in the back of your head near that base of your skull. And males tend to have a more prominent bump or protuberance than females, and it's due to muscles that are attaching there as well. All right, so with the occipital protuberance, which I'll circle here, what we have in the medial portion is going to be this external occipital crest that I'm highlighting here in green. All right, so here then, this again is going to be down the middle of the occipital bone, and from it, what we'll have is an inferior nuchal line and a superior nuchal line that are going to go horizontally, okay? And these are going to be attachment sites for different ligaments as well as for different muscles that help with the neck. So you can imagine these will be more prominent in males than in females. The sphenoid bone is an unpaired bone, and it's commonly known as the bridging bone because bone actually articulates with almost all of the cranial bones as well as the facial bone. So here I'm circling it in purple. All right, so let's go through some of its features. So let's start here in this bottom figure. And this now is looking at the sphenoid bone if you're looking at the back of the skull. So you're looking forward, and what we find here is the body of the sphenoid. And this will be found medially. Then laterally, there are the greater wings, which are going to be these large structures here, as well as these lesser wings that we find. And so up here, this will be superior, and then here is inferior. The pterygoid processes are going to extend now inferiorly, and these will act as attachment surfaces for muscles that help to move the lower jaw and the soft palate. So this is going to point down towards those lower jaw and towards the soft palate of our head. All right, and then lastly, the feature that we have is the sella turcica. And the sella turcica is what here I'm highlighting in red that we find medially. So I want to now go up to this image, and now you're looking down on the sphenoid bone. And the sella turcica will be right here in the middle. Very important because this is going to be a depression that's going to house one of the most important endocrine structures that we have, our pituitary gland. And so pituitary gland is responsible for many processes within the body and will regulate things like puberty, metabolism, growth and development, okay? And so the sella turcica is going to be where the gland will be housed, and it's going to be that special depression that we find again in the middle of the sphenoid bone. The ethmoid bone is a single bone, and this is an irregular shaped one found within the cranium, and it's between the orbits of the eyes, and it also helps to form the anterior and the medial floor of the cranium. And so here, what we have is the green bone represents the ethmoid. So you can see it also helps to form the roof of the nasal cavity, as well as part of the medial wall of each orbit, and is also part of the nasal septum. So it's found very medially in terms of its location. All right, so let's go through some of the structures. So the cribriform plate is found here in this image, and it is going to be lateral to this predominant structure of the crista galli, okay? So the crista galli is going to point upward, so superiorly, where it acts as a support for the brain. The cribriform plate then, again to the sides then of this crista galli, so if we look down in this second image, it would be on the sides here. What it has are many holes in it, And so the cribriform foramina will be the holes that we find, which these will be passageways for nerves for our olfactory system, which is for a sense of smell. The perpendicular plate is going to be inferior to that of the cristogali, and so in this image, I'm circling it right there. And then we have the superior and the superior and middle nasal conchae, and these help to form the correct temperature and water vapor percentage that we need for when we breathe in air. All right, and then lastly, what we have are the orbital plates that are found here on the sides, and these help to make the medial walls of the orbit for our eyes.